Meeting to order. Pursuant to the Illinois Open Meetings Act, meetings held remotely will require roll call votes for all action items. Um, to streamline, we've combined all the expected action items into one combined motion. So only one roll call vote is expected to be needed during the meeting. Will the secretary please call the roll?
Director Deere,
Here is here.
Director Harrington,
Present.
Director Story,
Present.
Chair Ryder,
Present.
and for the record, those directors also present. Director Robinson
Present.
and Board Chair Taylor.
Present.
You have a quorum.
Thank you, Debbie. The next regular meeting of the Finance Committee is scheduled for Thursday, February 16th, 2023 at 9 a.m. I'm going to now ask the secretary if there is any virtual oral testimony or submitted written testimony for the record.
No, we did not receive any testimony.
Great. Then moving right along, the first action item would be the November 18th, 2022 Finance Committee meeting minutes. These were approved by the board at the December meeting, but are being presented for the committee's review and discussion if necessary. Are there any corrections that need to be made to the minutes before we consider them later in the meeting? Any corrections? Any corrections? All right, so we'll hold those for later on in the meeting. We're now going to move to items under the Chief Procurement Officer. I'm going to go, we have a number of different items to be considered. I'm going to first move to the Cook County Department of Public Health, item number 1, which will be presented by Dr. Lamar Hasbrook, CCDPH's Chief Operating Officer. Dr. Hasbrook? Does
Chair
it
Ryder,
seem like
he has not connected yet? Would you like to move on and then circle back to him?
or Charles, is this something you can present in lieu of Dr. Hasbrook?
Hey, good morning, Charles Jones, Chief Procurement Officer. Yes, I can, if you'd like to go in that order, Chair Ryder.
Yep.
Also, before, I'd like to do a little housekeeping too. So item number 6 for Favored Health has been withdrawn, and item number 32 for Shared Medical Services has been withdrawn. So out of the 36 that you received, we have 34 presented today, and of those 34, 15 have responsive letters from the Office of Contract Compliance, so that's 17 outstanding. Just want to do that little housekeeping.
Okay.
So this first one is to increase the contract with Vega Partners for grant funding. It is the support implementation and monitoring process for the OPERA funding for Building Healthy Community Initiatives. Ongoing support will help meet the OPERA requirements. Vinny is a certified minority-owned business.
Good morning, Charles. I'm here also if there's any questions. Sorry about that.
Oh, there we go. That's Dr. Hasbrook. Go ahead, sir. You may take over.
I think you covered it well. Good morning, directors. Yeah, I think you covered it well. Yeah, the emphasis is just an increase. We were previously approved for 100,000. We'd like to go to 140,000, and that's through June of this year. Again, to help us with an ARPA-funded project in the community, really focusing on COVID resiliency and recovery. So I can take any questions if there are any.
Are there any questions for Dr. Hasbrook? Hearing none. Thank you, Charles, Dr. Hasbrook. We're going to move on to requests number 2 through 5 under Health Plan Services, which are going to be presented by Aaron Galiner, our Chief Administrative Officer. I will note that we have at least one director. I believe Director Robinson is going to abstain for the discussion on request number 2.
Yes, Chair Rudd, I will be abstaining from the discussion of request number 2 under the contracts and procurement items. Thank you.
Thank you. All right. Aaron?
Good morning, directors. Aaron Gleaner, Chief Administrative Officer. The first transmittal before you is a zero cost time only extension. We have a current RFP process underway, and this time only extension will allow time for that process to complete. The next transmittal is for interactive text and communications with our members. This is exercising a 1-year renewal option, and we expect to go out to RFP in late 2023 for this service. But this is interactive text to our members, which include a number of clinical quality and COVID campaigns to both educate and provide information on incentives and other programs that we have. The next transmittal is for behavioral health telehealth, and this is a 3-year contract. And then the final transmittal for health plan services is Alliant Insurance Services. This is the insurance broker for the county that the county uses countywide. This is from an RFP that the county issued and the Board of Commissioners has already approved this contract. We are bringing this to you so that we can execute our specific county care stop loss policy, which is done annually. And this is to provide reinsurance for high cost county care members. And I'm happy to answer any questions.
Any questions for Aaron? Hearing and seeing none, we're going to go ahead and move on to requests number 6 and 7. Ambulatory services. Ileana Mora, our Chief Administrative Officer for Ambulatory Services, going to present these 2 items.
Ileana, are you present? I see that you are with us, but are you muted?
Yes, good morning.
Good morning.
I want to present the medical home notework contract. We have, as we said in the last board meeting, that we were going to issue an RFP for these services. We have done that, and the current RFP is out there with vendors bidding on it. That is going to close on February 1st. This funding is to help us transition, is gap funding, to help us give us some time for the selection of the vendor, as well as the implementation of the services of the vendor, whether that's transitioning to a new vendor and getting us started with the new service.
Any questions on this item?
I do have one. This is Director Deere. Are we anticipating the RFP is going to close on February 1st? And this extension extended how long?
This is a 4-month extension.
So until 5/31. Okay, thank you. I didn't see it. Thanks so much.
All right. And then I'll go ahead with the next, or are we up to Claudia now?
Yes, good morning, Director. This is a service we use to make a diagnosis of patients with sleep disorders. This vendor provides the testing for our patients so that we can make this diagnosis in those patients.
Any questions on this item? If not, Dr. Fee can go ahead and move on to the next one.
Yeah, so this is capital equipment for the Department of Surgery. These include consoles and cameras that we use for scopes that are used in the operating room, as well as for arthroscopies. So it's just additional equipment that we require. There's unfortunately a life expectancy that's not as long as we would like for some of this equipment.
Any questions? If not, let's keep going.
Okay, so this is a partnership that we have with the legal to provide legal services for our patients. We find that it's beneficial for our patients, so we partner with this aid society.
Any questions on this one? All right.
So again, this is imaging equipment for laparoscopic procedures. We're increasingly doing these procedures which are less invasive, allow patients to recover more quickly.
All right. Any questions for Dr. Fegan on that one? Hearing none, we're going to move on. The next item, the next 12 through 15 will be presented by Shannon Andrews, our Chief Equity and Inclusion Officer. Take it away, Shannon.
Hi, good morning, directors. This is Shannon Andrews, Chief Equity and Inclusion Officer. The first item in front of you today is to request an extension on a sub-grantee contract with Dr. Matthew Epperson. This is a grant-funded extension that is in alignment with a Department of Justice extension on the grant work on behalf of the Comprehensive Opioid Abuse Site-Based Program. If you can scroll down a bit, Charles, I'm sorry. Yes, thank you. This will extend it through September of 2023. For our next item, we are requesting a extension and increase on a contract with MedOne Capital. This extension will allow for the continuation of lease payments for infusion pumps, epidural, and PCA pumps, as well as a software package that integrates directly into the medication administration record. This is a request for $1,152,000 to take us through December 15th of 2023. The next item is a companion piece to the other Department of Justice grant award. This contract is to extend and increase an agreement with our sub-grantee Family Guidance Center. This extension and increase will allow for the continuation of work and additional funds not to exceed $102,664. This too is in alignment with extending it through September 29th, 2023, and to make the sub-grantee contract in alignment with an extension that was provided by the Department of Justice to all of their fundees related to this work related to the opioid crisis. And last but not least, we have in request to extend and increase a contract with another sub-grantee, the University of Illinois at Springfield. This is a contract for staffing, training, and consulting that is in alignment with the original award of the grant. This is done in conjunction with the Department of Children and Family Services. This extension will take us through September 29th, 2023, as is allowed by the extension from the Department of Justice, and it is for an increase in the amount not to exceed $43,663. And if there are no questions, I think that those are all for me.
All right, thank you, Shannon.
Thank you.
Next, the next three items, 16, 17, and 18 are going to be presented by Pam Casara, our Chief Financial Officer.
Thanks, Chairman. Pam Casara, Chief Financial Officer. The next three items are all revenue cycle items. This first one is for Great Lakes Medicaid. Great Lakes is our Medicaid eligibility vendor. This is a request to extend and increase an amount not to exceed $1.8 million. This is to exercise the second of two one-year extension options. Next item is Meduit. Meduit, this request is to amend, extend, and increase. Meduit is our early out vendor, works accounts for basically the day 1 to 120, and this request is to exercise the one-year renewal option. And the last item, I believe, is Certiv. Yes, Certiv is a new contract. This vendor, Certiv, will look for missed revenue and charges. It is a contingency-based contract. It is a one-year contract with two one-year renewals. And Chief Revenue Officer Curtis Haley is also on if there are any questions.
Any questions? All right, we're now going to thank you. We're now going to go to Angela O'Banion, our Chief Information Officer, for request number 1920.
Good morning. The first item before you is for our patient throughput system, which is teletracking, and it is for 1 year as we continue to explore process changes and needs for this particular service. And this will this service provides tracking of patients throughout their stay in the hospital. The next item is for Juniper. Juniper and Mist is a product and a series of products that provide wireless access coverage extension for our Ethernet service throughout our hospital campus, and it allows for better and improved internet access. And these devices will replace a few older devices and be additional wide area access points. Syntax is rounding software that we use during the environment of care rounds for all a number of various services, including buildings and grounds. It allows us to get immediate feedback and ticket and survey our services throughout the hospital campus. And this extension is for a 3-year period. Innovate is the company that we use for our workstation on wheels to provide primarily bedside care. And these workstations on wheels are, this particular set is for respiratory therapy. We will be, we are replacing several outdated workstations on wheels, also known as WOWs. And then we also continue to place them in storage because they are very highly used, and sometimes wheels break and small things like that. Thank you very much.
All right, we are now on to Human Resources. Valerie Amos, our Chief Human Resources Officer.
Good morning, Chairman and the board. This is Valerie Amos, Chief Human Resources Officer. I have one contract before you to amend, extend, and increase. This is for Slalom Consulting. Slalom has been with us for the past 6 months, and this is an opportunity for them to extend through July 19th, 2023, not to exceed $2.3 million dollars, and their services have been really transformative within the HR team. They have been with us to assist with recruitment process steps, streamlining those steps, ensuring that there are training plans. We've trained the management team within CCH. We've also accelerated hiring with the support of Slalom. They have been tracking and trending data. They have also been working in conjunction with the CIO, Angelo Banyan, as well as working across the BI team with Amanda Grasso and team so that we can improve our technology solutions as we digitize a number of our work outputs. It's imperative for us to maintain Slalom support at this moment. We don't have sustainable resources in-house within HR to continue to work on these strategies without the support of Slalom at this moment. We will be readying, our group to sustain post Slalom's departure. We are looking for an additional 6 months. Thank you, and I can take questions. Thank you so much.
Next up is Bina Peters, our Chief Nursing Executive.
Good morning, Chairman and the Board of Directors. I am Bina Peters, Chief Nursing Executive. The item before you is to increase the spending limit to $30 million for the VIA nursing contract. Currently, we are using the VIA nursing contract to support the existing nursing vacancies across the system, as well as the recent increase in the volume that we are seeing. So this is an increase in the amount of spend. Please let me know if you have any questions or comments. Thank you.
Any questions or comments on this one?
So this is directed here. Just for the record, one of my questions, and Ms. Peters knows this already, as I was inquiring about the report on this particular vendor, we would do, I thought they were quarterly reports, but maybe they were a little bit longer, as to, how we're utilizing our vendors, the MBEs on this vendor, how they're being used, etc. I know that I think we last got a report in August sometime, so we're definitely due for a report relatively soon. We asked for these reports when we initially passed, just because there was some concern about it. So I'm just putting that out there that, my hope is that we can get that report relatively soon.
Thank you, Commissioner Deere. Yes, we will bring the report back. I believe we are reporting every 6 months. Charles, please, keep my memory. But we will be coming back with an updated report to this, committee soon.
That would 6 months would put us probably in February or March. Does that sound okay, Dennis?
Yeah, February would actually be it. Let's verify that it was 6 months though, because my recollection was quarterly. But nevertheless, my concern is I'd like to get some information, at least at minimum, before voting to pass this. And maybe that's between now and next week that we can at least get some preliminary information on how we're doing with this contract, because I don't know.
So a written report would be a written update would be fine, or something included in the briefings, Dennis?
Either or.
Okay.
I just think it's important for us to know that if we're talking about extending the limit to $30 million.
Yeah.
So if we can do that, that would suffice.
Yes, I can reach out to Commissioner Deere and also provide an update and also a written report on the status in the next, in a coming week.
Thank you so much. I appreciate it. Appreciate you.
Thank you.
Director Story.
Thank you, Chairman. Good morning, everyone. Dr. Peters, could you just share with the body where nursing with this agency is going around the country? Are we seeing any reduction in the hourly rates or the utilization of agency nurses across the board? What is the market looking like today? If you could just provide us with a quick synopsis, I appreciate it.
Yes, thank you, Dr. Story. Yes, the nursing agency, the market, we watched the market hourly rate bi-weekly. It went up all the way to $215, and now the market trend is around 150 to 175 an hour based on the specialty. Overall use of agency across the country slightly dipped. However, the usage is remained to be somewhere from 35 to 40%. What we are seeing is seen across the country. And I was attending a CNO meetings, and all of the CNOs face the same thing. Especially many nurses left the bedside to the attractive the salary of the agency rate, and they are not coming back because the job is out there. And also there was a study published 2 months ago. The vacancy rate of the travel nurses, because these are the agencies recruiting nurses, still continue to be over 200% compared to 2020. So the market is very tight. The rate is still high compared to pre-COVID, and also many nurses are choosing to stay in this market, which is travel agency, to be a travel agency nurse versus picking an institution to join.
And,
So
and by
we're
the
looking at,
if I can, real quick, Director Story, and then I'll kick it back to you. It's an observation because my position relative to employment and healthcare is that there are a lot of, I'll put our system aside because it's unique in that we're a large unionized safety net, whereas a lot of the sector doesn't have representation, and you know the there's a lot of dissatisfaction with people generally in, especially amongst younger generations, and we're it's manifesting itself in a number of ways in this industry. you know it's working for a big fancy looking hospital but not getting what you want out of that employment. The way that you can get more wages and benefits is by going out into the market, because a lot of these institutions don't have defined benefit retirement programs like we have at County Health. They don't have as they have access to healthcare, but they don't have access to work rules around scheduling shifts and scheduling and being able to have any predictability in their life. So those types of workplaces end up polluting the market for everybody else, because people's reaction is, if I don't have a say in the way my workplace is going, I can have more control by working as an agency nurse and sort of dictating the way my life looks. And I see Bina nodding her head, so I'm
Yes, there's a lot of work flexibility and the rules, and Cook County or the county system or public health system has the benefits, the long-term retirement for the younger nurses. That is not their priorities, right? So they love the flexibility as well as the pay. And that's what we are seeing across our country, and your observation is absolutely correct, Chairman.
Yeah. So we end up paying a, a a premium because of everyone else, the way the market looks in all the private not-for-profit hospitals.
And also
Well,
just wanted to go ahead, Chairman. Let me share also the other private system has much more flexibility to adjust the staff nurses' salary and wages much faster compared to public systems. So that also is impacting, our ability to expedite the hiring.
well,
Which is a different issue.
Dr. Peters, you and the chairman have already sort of answered my question was basically, we're seeing a paradigm shift with respect to how young nurses view their workplace or their careers in terms of wage and salary compensation. That this hourly rate that pre-pandemic is not something that they are enamored with. That they're going to demand, if you will, a different interaction with their employers going forward because of the things that you and the chairman have shared with us this morning. It seems
Yeah.
like we're into it. It's a new wave.
I mean, if you look at it like this too, is that when they're when they're working when they're working as agency, they're getting a rate that would that wraps in what what their vacation pay, their what they would put into their retirement. It all gets piled onto that rate, which makes the rate higher, but also they can they're they're able to they're able to help drive the market. So, I don't know, once you do the actual financial impact of what we probably on balance are, when you consider all those factors, what we pay our nurses plus what we get them in benefits, you know, county's the place to work. Relative to other employers though, I mean, I would say probably the, University of Chicago Medicine is probably the most comparable to us because they're another system where the nurses are represented, so they have more stability and security and more predictability with their pay and benefits. So you know the until the other big guys you know do better with that, and we can also continue to fire up our hiring, get our hiring going. We have two different disadvantages when it relates to agency that come from different directions in terms of cost.
Dr.
Excellent point.
Peters,
Yes.
well, we talked about this before, and when I listened to what the chairman said, in addition to what you've said, it does not present a very bright picture because I think everyone can say the millennials have a very different way of looking at work than some of us that are older. So I don't see a good strategy going forward to get out of this dilemma of paying this higher price. That's where my struggle is here because there has to be some way to think about getting out of this. But right now, it doesn't seem very likely from what has been stated.
So it actually there is a path. So I mean, it's not the path to correct what the market looks like in terms of what agency is paying. For us though, we've we vastly have improved our position in terms of where we were at, let's say 7 years ago, on being able to onboard um, people generally, including nurses, and we've put a huge dent into that. As we're able to, um, keep up with attrition and the turnover rate, and we start closing that gap, uh, that is our way to do it because we are, as between the what we pay in terms of wages and defined benefit programs, we're a better answer for anybody in the market thinking about their long-term viability, right? As in this field, we just have to, we just have to continue to plow forward and get people onboarded. And as we do that, I know the 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 issue that gets presented is we're and I've been a critic of this myself in the past, that we're too reliant on uh, agency generally, whether it be nursing or something else, staffing agencies to bring people on. But in the last 2 years, and specifically in the last 12 months, we are starting to, instead of um, having a problem that we don't seem to ever find a way of solving, we're actually solving the problem. We have a number of career fairs and things like that, but you know, we're closing the gap, and it's a strategy that's been built on two different things. One, the has been to actually invest agent if we're going to invest agency, we need to invest agency into human resources, so human resources can do the job of moving people, right? We've negotiated all of the side letters and memorandum agreements to help streamline the process with the nurses union, working with county, with downtown on all this stuff. Now we actually need the people who can move people through the system. We've done that. We're hiring people where we have agency staff to help us hire people in HR, which then helps us, but also helps us then move people through the system. And I know, and Val will speak to this in a second. So in my term I've been on the board. Debbie, correct me if I'm wrong. I'm somewhere around 5 years, right?
Yeah, that
And
sounds right.
and I've been, I was throwing rocks at the building before that. And my predecessor in my role at my day job was on the board. So I've been paying attention. There's we had there was years ago we had enthusiasm that things were going to get done. They didn't actually get done. Now we have enthusiasm with 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 some real good short-term results that are indicators to long-term progress. So I'm going to go to Val first, and then I see that Director Harrington has his hands up too. So Val, why don't you go first?
Sure. Thank you so much, Chair Ryder. Director Robinson, just to accentuate what Chair Ryder mentioned, we have definitely attempted to make some impactful changes here at the organization. We are now going to be hosting our 17th and 18th job fair since June of 2021. That information was sent to all of you as board members, as well as the Board of Commissioners, as well as cascaded across kind of our community on social media. We have been actually promoting our employment opportunities in a much more visible fashion. And you'll hear more of that at next week's board meeting from me. But most importantly, we are engaging in the community. We are aligning with campus partnerships and recruitment. We are working with workforce agencies such as Cook Workforce. We have been attending outside job fairs. We've been collaborating with our employment plan officer, again, as well as our vendor support to streamline our recruiting processes to just frankly hire faster. Part of our challenge is that we were getting in our own way. And so we've tried to make those modifications to really focus on nursing. In collaboration with Dr. Peters and her team, we have outlined a weekly process for her team to actually review candidates, have scheduled interviews, and make some quick decisions in terms of hiring. So really promoting all of those items, I think has really been helpful for us. We still need support. We definitely need support to advance our mission, but I think we're on the right track. And so thank you for allowing me to share that information.
Wait, before you go, question.
Sure.
Okay, so if we were to take this and make it into a mathematical equation and have an input versus an output,
Mhm.
and so you've already, for the input, you've given us quite a few ways in which you're trying to get more people into the funnel, but the
Mhm.
output is still coming out. Do I see the flow rate or the change between input and output? Do I see the decrease in that they're coming together? I.e., um, are we slowing down the pain as far as how much we have to actually go to these agencies because we're getting more people in? We haven't completely fixed the problem, but have we
Correct.
reduced it, and are we actually making grounds?
So in our last fiscal year, for the months of August, September, October, November, we were tracking and trending in the right manner. And we actually saw more external hires than separations. So to answer your question, yes, we started to gain some ground towards the end of fiscal year. Now, of course, the first several months of that fiscal year, when we didn't have all of the resources that we have today, and all of the optimization items that I mentioned, we were not clearly as fast. However, we did see the tide changing. Now, we'd like to, of course, accelerate that 3, 4 times. So we will continue with our momentum, but we did see some changes. So thank you for that question.
Yeah, and I think it'd be important to note, Val, that when the beginning of the year was when we were starting to execute the plan
Correct.
to do this. The
Correct.
first, you know, the the new team got planted
Correct.
in I'm gonna in 2020 at the you know at the end of 2020, and so 2021 was the really the figuring stuff out. 2020 and dealing with COVID, by the way, we were figuring stuff out as we were in the heat of the chaos of COVID. Um, the 2022 was, you know, starting to scale up to
Execute.
execute the
Mhm.
plan.
Mhm.
2021 was identifying the issues and starting to prepare the plan. 2022 was the beginning of executing the plan. So
Mhm.
it's been, for me, it's been a pretty dramatic shift.
Appreciate that. And I know I started mid 2021, in June of 2021. So getting acclimated, understanding the health system in general, that took some time as well. But most importantly, my colleagues, the support from Mr. Rocha, the support from President Preckwinkle, and just, the collaboration with a number of our labor partners, I think has been critical to our success. Director Robinson, in addition to that, first time in the history of the organization, as I understand, we also have recruiting bonuses that we are able to provide to eligible hires, kind of based on the criticality and eligibility criteria. So we are focused on really eradicating the agency spend and costs associated with that, and sharing it with new hires, as well as retention programs in place as we continue to impact bargain with our respective labor partners. So thank you so much again for allowing me to chime
Yeah.
in.
I'll
And
toss.
I'm
I
sorry.
would like to toss one idea out there if you
Sure.
haven't done. I think I mentioned it last time, but one of the things that could be effective in helping to increase your
Mhm.
input
Mhm.
is if you go to some of the schools and offer scholarships with a
Yes.
certain amount of commitment, because the military does it all the time. Yeah, I had to do the army for 8 years because of that requirement.
That's awesome. And you've actually touched on something else that we've done for the first time. The county, President Preckwinkle, and the Rainbow, I believe, I'm gonna probably mispronounce it. Anyway, we received funding for to establish a scholarship fund. And so Director Story, Commissioner Deere, Mr. Rocha, President Preckwinkle, and I believe Nick Shields, and of course our CCH Foundation. Everyone was instrumental in identifying that we had a need so that we can support the community and attract individuals to our organization. And so for the first time, we launched a scholarship fund, and we were able to identify multiple individuals, 30 individuals who have received funding for their medical dental programs, as well as other allied programs. So we touched the lives of high schoolers who were stepping into college. We touched the lives of individuals who are already in school and entering medical and dental programs. So our goal is to continue with that momentum. We were very grateful to host that for the first time, and we will partner with our foundation colleagues to continue with that momentum. So I wholeheartedly agree with you. That's an opportunity for us to reinvest or invest in the future, and also bring those individuals to our health system or in the county system in general.
And
Thank you.
thanks. And one thing I'd like to add a hospital to what I would think would be one that would be comparable in terms of structure and operation, though not completely serving the same population, but that'd be the University of Illinois Hospital too, which is right next door. All right, Joe's next. Oh, Joe,
Joe, you're on mute. Joe,
Joe, you're on mute.
Joe,
I'm
can't
off,
hear you.
I'm off mute now, and I apologize for that.
That's all right.
I just want to make a few comments, and I don't want to beat a dead horse because we have been talking about this. And I guess what really has me concerned is the national trend right now. And the question is this a trend or is it the new normal? And we may not know for a while. And what happened in New York City with thousands of nurses walking off the job, for me personally, is really disconcerting moving forward. And I'd hate to see something like that happen in Chicago. I think we're on the right track. I think we're doing the right things. I applaud the system for the things that they're doing and reaching out. But the real question is, are we seeing something that's just a trend and that trend will change, or is a new normal? And I think we have to be prepared to adjust because things may not go back to the way they were pre-COVID. And we may be dealing with this for a while. And at some point, we may have to rethink how we do things moving forward.
Well, I would defer to Israel on this, but you know, I think we have the United States is very unique in this, in that there's very much regional differences in how places are operated. I mean, the Midwest is different than New York and also different from California. And in New York, the public systems have a really strong foothold in the highest dense area. In California, Kaiser Permanente is the big force. And here in the Midwest, it's us and then the large not-for-profits. And you know, the it's it, I, we're sort of a hybrid of what those two different things look like, with less representation amongst the staff. We're not at the same level as New York or California. So, um,
I can, Director Bernard can add a little bit to that as well. And I agree with you wholeheartedly on the comments that I believe Cook County Health has a very, very competitive offering when you factor in our benefits, our wages, our free tuition to nurses for all the way up to doctoral studies, everything that you can do, and to have an empowered employee experience. And I know that both Bina and Jackie Witten are working to our across our system are working to implement pathways for Magnet that has even more empowerment in employee councils and nurses councils and divisional councils. So when it comes from having an empowered experience, that's what we're working towards and building and making stronger, and we're going to make it even better. It provides for excellent benefits, ways that you can structure your life, your work style. At times we have differences in how we get there, but it allows for that conversation to happen. And I think that, to your question, Dr. Harrington, I don't know if the answer has been settled whether this is temporary or long term, but what we can do And what I know for certain is that not everybody wants to work with agency and have that instability. And when you factor in self-employment taxes and the lack of benefits and others, maybe sometimes the wages aren't everything that they're advertised. And so as people start to see that, some people are returning. And it's just going to come down to a way of life. And what we can do is do everything possible to create the best environment and provide the best resources and the best benefits. And as always, we're limited by what we can pay, because at the end, you're seeing a lot of hospitals become unstable because they cannot meet these rates that agencies paying. And at the end of the day, it's also, we're going to need some help if that force continues. You're already seeing people reach out to their legislators and others to try to help, because you can't pay what you do not have. So it's finding that right balance. What we can do is to create an empowered employer experience where they can empowered employee experience where the employer and employee can work together as best as they can and provide benefits and resources. And while we have a lot that we can do better, there's a lot we're doing right. And I would say that if you look at our benefits package, the tuition, the reimbursement, the recruitment, and what we're doing, it will be helpful. The other thing that is not talked about, and it's just something that we can learn from, not something we can write at this point, is that we waited too long as an industry and a nation to address the fact that we had a large number of retirees in our workforce, and that we saw this coming. And unfortunately, it's coming to roost at the same time that COVID had hit and other factors are in there. And so what we see is we have a lot of retirements as well every year, and that's okay. People earn their benefits in the retirement and their pension, and if they've worked and given us 20, 30, 40 years, they're entitled to the retirement. So we need to work with them and honor their service. And that's a great thing. That's why our services and benefits and pension employees are there. We just have to learn going forward that when we're seeing that barbell happen, which is what almost all healthcare organizations see, you see that a group of employees have stayed with you and they're over 15 years of service, and then the other group of employees are under 5 years of service, and you have that gap. We are putting work programs in place now to also expedite the hiring of managers. We're doing a holistic review of what our manager salaries are so that we can increase them and make them more competitive so we don't lose them. But a lot of our efforts have been not just to recruiting employees externally. We also had some employees leave us because we weren't as effective in promoting within. And so we have also addressed that as well, and have seen a huge number of increases of our own employees staying and growing in the organization, which we like, because before we were losing them. So at the end of the day, all we can do is make sure that we're as efficient, that we have as empowered experience as we can, and that we're paying as much as we can to our employees, and that we have good benefits, good service, and that we continue to be a good employer. And the faster we can get there and the more nimble we can be, the more competitive we'll be. But I hope that what we offer will be attractive for enough employees for us to do business. I don't know if nationally we're going to get the answer whether agency will ever be eliminated, but I think it's here to stay in larger numbers than it's been in the past. But I think we can be competitive and attracting enough resources to help us stay in business within our margins.
All right. Thank you, Israel. We're going to move on here in a second. I just think it's interesting that my entire adult working life is working in policy, and workforce, is that we've been talking about the graying of the workforce, and that it was all coming to a head by 2020 and 2020 and then 2020 got here. and everyone who wrote a paper about it was right. So
yeah.
Okay. Any other questions on this item? All right, let's move on to the next one. All right. This is Craig Williams, our interim chief administrative officer for operations and development, has a number of items. Craig, go ahead.
Great. Thank you so much. Good morning, everyone. The first one is for Anchor Mechanical. It's an extend contract through 11/23. It has no dollar impact. This was originally approved through an RFP for a 3-year contract ending 11/19. We extended and increased it through 11/22. This vendor provides monthly maintenance services to the refrigeration and ventilation equipment at Stroger Hospital. The next one is a Safe Haven Foundation. It's an extend contract through 11/23 with no dollar impact. It was originally approved through an RFP for a 3-year contract ending 10/20, and then we executed extensions in that contract, and this vendor provides snow removal across Cook County Health. Medical data logistics, this is an extended contract for 7 months through 6/30 of 23 with no dollar impact. An RFP has been issued for these services, and we've received those responses back, and we're in the process of compiling those. And we expect to award that contract in Q2 of FY23. And this vendor currently provides prescription claims processing services. Save RX, it's an extended increased contract through 11/23 for a total of 1.3 million. Was originally a 2-year contract that expired 11/30/22. And the vendor provides prescription call center services for our mail order pharmacy program. Desmond Inc. is an extended increased contract for 24 months, 3/1 of 23 through 2/28/25 for a total of $385,203. This is an approved CIP project for the Sturgeon parking garage renovation, and this will also be brought to the county board. The next one is Maxim Healthcare Services. This is an extended increased contract for a total of $16,954,080. This original contract was for 36 months, ending 11/20, and we've exercised renewal options in that contract. This contract provides agency staff and some of our support services areas in the areas of greeters, screeners, transporters, call center, some lab staff, and also some staff within materials management and finance. The next is Corsair, a similar extended increased contract for a total of $14,744,800. It's a 1-year extension through 11/30 of 23. The original contract was for 36 months, which expired 11/20, and we've exercised extensions in that contract. This contract provides support service staff in the areas of greeters, screeners, transporters, call center, radiology, and some of our clinical services. So these two contracts we sort of use in conjunction to obtain agency staff to really cover for vacancies, leave of absence, or approved FMLA. And then we also have about 50 positions that fall into these categories that were new services that we've brought on related to the COVID pandemic. So an example would be the screeners at the front entrances, which are checking temperatures. So we're unsure of how long we'll continue to provide those services or how we'll adapt that. So we haven't developed new PIDs for those positions.
So, can you talk about the performance under this contract in terms of Core SAE, how many people you've been able to place, utilizing them, any issues with candidates that they've sent over, anything related to that?
Yeah, I mean, I think it's important, using the two companies together, certainly it sometimes allows us to get into a bigger pool of candidates. I'd say Corsair, they've been easy to work with. They respond to concerns and inquiries in a timely manner. They've met the goals of the contract. They've placed a number. I don't actually have at the tip of my my head exactly how many positions we filled, but Corsair has been responsive. I'd say kind of on a scale of 1 to 10, I think we'd grade them out as about an 8 in terms of responsiveness and performance and everything else.
All right. Joe, did you have any questions about this one?
Not questions, but concern based upon a review of their website. I only saw 2 jobs posted, but maybe they're doing a better job than their website indicates. And their location it didn't look right. So I did a brief search. And so,
So,
but I'll accept what you're saying as fact.
I mean, in terms of geographic location, I don't live that far from there, and that's an office industrial area. So, any other questions? All right. Next one.
Next is by Maru. It's an execute contract from 2/23 through 1/26, not to exceed $1.177,452,452. This vendor provides reagents, kits, software for our multiplex PCR testing in the lab for sepsis, meningitis, and GI conditions. The next is Fuji Diagnostics. It's an execute 60-month contract for 2/23 through 1/28, not to exceed $466,307. This is for syphilis testing kits in the lab. This is a sole source, mostly because of the technology they use to process these tests. They use gelatin particles, which have been found to be more sensitive than other techniques used in the market. So this is our preferred vendor. The University of Illinois at Chicago, it's an execute of a one-year contract not to exceed $186,900 to continue to provide supplemental ND services for our neuropathologists within our lab. And then MedSpeed LLC is our courier service that provides transportation of patient samples and lab supplies from Provident, Cermak, and ACHN clinics back and forth to the lab at Stroger Hospital. This is an extended increased contract, 12/22 through 11/23 for a total of $550,000. Any questions on any of those?
Any questions for Craig? All right. We are now, thank you, Craig. So I believe that brings us to the end of the list. And now we're going to move on to the report on minority and women-owned business enterprise participation, which will be presented by our Chief Procurement Officer, Charles Jones. Charles?
Yes, good morning again. Charles Jones, Chief Procurement Officer. So since we didn't meet in December, we have two for you. We have the month of October and then the November numbers. In the middle of the column for October 28th, there was 27 contracts presented before you. 3 of those had contract-specific goals. Of those 3, we had one minority vendor as a prime for $2.3 million, roughly 7%. And we had 2 subcontractors for $11.5 million, so 32% there. So roughly 39% for the October contracts that came before you, approximately $13.9 million. Looking at the December 9th board meeting for the November 18th finance, of the 20 contracts, 7 of them had contract-specific goals. 1 was a prime, $384,200. 6 had subcontracting $44.3 million. So there no waivers for the month of October and November, all participation, either primes or subcontracting. So that rounded out the year of FY22. If you look over to the far right hand, the last column there, over 288 contracts that you approved. 89 of those were contract-specific goals for a little bit over $715 million. 11 were primes, $12.9 million. 56 were subcontracting, $165 million. So overall, about 25%, and $178.3 million over the course of the total year. There was 22 waivers, a little bit around 4%. Next slide, Debbie, for visual. All right, so that's October 39, November 29, and roughly 29% for the year. Any questions on the metrics?
Any questions for Charles? All right. Charles is going to present the fiscal year 2022 fourth quarter report of contracts executed on the CEO's authority in February. So we're going to move now to the report of emergency purchases. And Charles, there's two being presented.
Yes, sir. All right, so there's a December and November. We'll take them in reverse. December was molecular imaging for a 12-month contract, $1.136 million. This is radiology for the Department of Radiology to outsource the MRI and the PET CT imaging to service Cook County health patients. We did outsourcing there to assist as we continue to look to improve our throughput. And then in November, we had a request for an emergency provide a contract amendment to extend and increase the contract period and a not to exceed with Varian Medical Systems, 6-month extension, $282,000. This is so the vendor can continue to provide software support and maintenance for our linear accelerators and to provide brachytherapy products for our oncology patients. Any questions?
Any questions on this? That's it, Charles?
Yes, sir.
All right,
All
thank
right.
you.
Thank you for your time.
We're now going to move to items under the Chief Financial Officer, Pam Casara. The first is to receive and file grant award related items. And then Pam will likely go into her interim fiscal year 2022 financials.
Sure. Thanks, Chair Ryder. So yes, in front of you, you do have the receive and file grant award and renewals. You can see $3.8 million. These are all amendments or extensions that had been previously approved by the county board. And the big one there in the middle, 3.5 million for COVID, is an extension just to June, as we have not spent all that money. And if there are any questions, I believe Dr. Hasbrook might still be on the phone. Hearing none. We'll move on to the financials. I'll be sharing with you, as Chair Ryder mentioned, our preliminary November year-end financials. And for the new Director Robinson, the committee member, the year-end financials are kept open for us and the county several months after the year-end in order to properly record as much as possible in anticipation of the audit, which will be done around April of this year. So these are preliminary, and right now we are coming in with a 15.8 million unfavorable variance to the budget. Another difference between us and the county, we do our books on an accrual basis, and the county does it on a cash basis. So on a cash basis, they're showing us at a 366.4 million favorable variance. And those differences are primarily just due to the timing of how we each record our revenue and expenses. But the drivers have remained the same pretty much all year long. On the revenue side, that variance is comprised of a positive variance in revenue, primarily from some catch-up payments from the state on the hospital side, and then the higher than budgeted county care membership. And on the expense side, a negative variance in the expenses, again, driven by the purchase services being over budget, and the county care claims expense also being over budget. Next slide, Debbie. So here are those, here is the financial, the preliminary, and again, to the right there, we have sort of our caveat, all the year-end work that's underway, various year-end accruals, final county care numbers, fixed assets, final reserves, et cetera. And then in the blue, there are several items also that we wait on the county to provide us those numbers. So Again, 227, almost 228 million over budget on revenue, 242 million over budget on expenses. Those variances I just spoke to, but 104 million bottom line, the budget 120, but right now a $16 million negative variance. And again, though, I do anticipate these year-end adjustments may close that gap. So we'll have final numbers at audit time. Next slide. So volumes, as we've been reporting all year long on the inpatient side, we not too far behind our budget. But on the outpatient side, the gap is primarily driven by, again, the Provident expansion planned to be open all year and budgeted for all year, but the ICU didn't open until April, and then the ambulance runs commenced in October, but still better than prior year to date. And as we'll see on the next slide, volumes continue to climb. Next slide, Debbie. So here again, volumes just depicted graphically over the last few years during COVID. You can see after the big dip in 2020 that we have pretty much rebounded back to 2019 levels in most cases. Next slide. Payer mix, also during the pandemic, with the pause on redetermination, folks were able to retain their Medicaid coverage. And then with the expansion on the newly eligible 42 to 54s and 55 to 64s, we continue to see the Medicaid climb and the uncompensated decline. Next slide. Revenue cycle. Revenue cycle is our Cinderella story. They are all wound up all in the green at the year end, met all their targets, and are continuing improvement through fiscal 23. Next slide. Same on denials. They continue to trend down, which is what we like to see, and efforts around properly classification so that they can attack the underlying root cause and prevent it from happening in the first place. Next slide. Charity and public program expenditures. So as we've talked about again, we've continued over the last few years to see traditional charity care come down and bad debt come down, as well as people have retained their coverage during the pandemic, as well as the expansion. But as a percent of our revenues and percent of our costs, pretty consistent year over year. Next slide. And then our savings initiatives, again, revenue cycle had some sort of unbudgeted goals to achieve. They achieved them. So we budgeted 25.5 million, achieved 30 basically. So they hit it again out of the ballpark there. And we budgeted another 30 million for fiscal 23 as well. Next slide. County care. Of course, county care's story this year is basically shown in the graph at the bottom. We budgeted the blue bars for the membership to decline, anticipating that a redetermination would start at the beginning of the year, which it did not, and we were able to retain the membership all year long. So they came in at 11.5 million bottom line for the year. Next slide. And then more care, as you know, we are exiting more care, or did at the end of December. So as of November, we had one more month to go, but a $7.2 million loss. They were budgeted for 8, so almost $1 million less of a loss than budgeted. Overall, a very positive year for fiscal 2022. Any questions?
Any questions for Pam? Right. So that brings us to the end, unless anybody has anything else. We're going to do a combined motion. So it would be a motion to accept item 3A, the November 18th, 2022 Finance Committee meeting minutes. Approve item 4A, contracts and procurement items containing request number 1 through 36. Subject to completion of review by contract compliance, and receive and file item 5A, the grant award related items. Is there a motion?
So moved, Director Harrington.
Motion's been moved. Is there a second? Director Deere, Commissioner Deere, are you still there?
Second. Said second.
Director Deere seconds. Any discussion on the motion? Hearing none, will the secretary please call the roll?
And Chair Ryder wanted to note, I think as part of the motion with regard to the transmittals, we wanted to note that number 6 and 32 are withdrawn. So with the
Yes.
exception of those two. Okay, thank
Yep.
you. Roll call on the combined motion, aye or nay. Director Deere,
Aye.
Director Harrington,
Aye.
Director Story. Director Story, I believe he had to step away, and Chair Ryder.
Aye.
So you have 3 yays and 1 absent.
All right, great. With that, I mentioned earlier that our next meeting will be held on Thursday, February 16th at 9 a.m. Of course, these items will be considered as part of the minutes for the board meeting later this month. If there's any concerns going into the board meeting, please let staff know, let myself know. That is it. With the agenda exhausted, we're adjourned.
Thank you.